South African Human Rights Commission has taken a stand against the deteriorating road infrastructure in the Eastern Cape. Their recent report highlights how these poor road conditions are a violation of basic human rights, affecting access to healthcare, education and economic opportunities for countless residents. According to the report, about 10% of the roads in the province are paved. This is significantly lower than the national average of 25%. Let's discuss the findings of the report further with SAHRC Eastern Cape Manager, Dr. Eileen. Dr. Carter, good morning. Thank you very much for your time and welcome to the program. So the Eastern Cape encompasses a vast provincial road network. I think it's around 40,000 kilometers and it's one of the largest in South Africa. So to have only about 10% of that paved is astonishing. What did you find out about how this affects the human rights of the communities there?
Good morning, Iman. Good morning to the viewers. Well, roads are seen as an enabler. It's seen as a catalyst that makes it possible for us to realize other rights, such as the right to education, the right to health, and even the right to safety. So after the Human Rights Commission received a continuing number of issues and complaints regarding the roads infrastructure in the province, we identified this as a systemic concern, and we then hosted an inquiry where we had complainants as well as respondents come to the table and provide evidence under oath in respect of the extent of this concern.
So you received complaints from residents in Lusikisiki, Kofi-Mvaba, the Mquma local municipality, Kamani and Tsomo. And you mentioned again that they had given a number of those community members gave a testimony under oath. What did they tell you? What were their stories?
Stories ranged from safety concerns to health concerns to business concerns. It is such a wide-ranging issue that it affects the farming communities in the province, but it also affects the taxi operators. We heard from the respondents in that respect where the MEC of Education came to the Commission to say the enrollment age of learners in the Eastern Cape is later because the children and the small little guys can't traverse the roads to walk to school in a disaster situation or where bridges have collapsed. Similarly, SAPS indicated that when they have to respond to incidents, they cannot do so quick enough. Think GBV, where they can reach the victim because their vehicles simply cannot traverse the road. Department of Health indicated that because their response time is slower than they would want to because the vehicles are unable to drive through the areas, their medico-legal claims are on the increase. So it's a wholesale issue. It affects business. We heard from co-ops who had to, whose businesses had to create job losses because they simply cannot get the products to the market. So the dilapidated road infrastructure, because it is a catalyst towards the realization of first and second generation rights, we have to address it because it would lead to economic development and the communities in the Eastern Cape to actually have their human rights respected.
Yeah. I mean, you talk about those medico-legal claims. By the way, the Eastern Cape has the highest number of such claims in the region of about 16 billion rand, I think was the last number I saw. And it seems counterintuitive. What did you find out about what's leading to this low coverage? What are some of the problems that have resulted in this low coverage?
So it's what we view as a cyclical neglect. The current budgetary allocation, which is aligned to the equitable share, is simply not providing the province with enough money to do a proper capital investment. So it'll cost 18 million rand per kilometre to repave and upgrade these roads, which means it'll take us 25 years at the current allocation to just address what is before us. So surely we can't wait 25 years to allow businesses to reach markets, to reduce unemployment and actually create development in this very important province. So that is why we've made very clear findings with recommendations, 33 recommendations against 10 respondents, for all of them to come to the table to address old problems with new solutions, because it cannot be business as usual anymore.
All right, we'll come back to those recommendations in a little more detail if we have time. But what's puzzling, though, Dr. Carter, is municipalities have returned 2.2 billion rand in grant funding to the National Treasury over the last 5 years. Some of the money potentially could have been spent here. Going forward, SAHRC has committed more than 60 billion rand towards road infrastructure over the next 5 years. So it seems as if there is money on the one hand, and this might point to a leadership problem. Take the money spent and account for it properly and deliver the service. Am I oversimplifying how the province should respond?
Well, I do think we need to look at all the role players, municipal roads, we need to look at provincial roads as well as national roads. All of them have a role to play. But also we need to start asking the questions about the prevalence of proper rail. Now, if you don't have goods going to the market through rail, you have the trucks on the road driving through these very specific local municipalities and perhaps also damaging and contributing to the wear and tear. It's a wholesale approach. It is not enough to say the municipalities are not doing enough, but two things can be true at the same time. What we have found, and through the intervention also from the Auditor General, is that there is underspending, but also, again, and I'm going to refer back to the equitable share model, it is simply not working in rural provinces and developing provinces such as the Eastern Cape when we try and address these infrastructure backlogs through equitable share. Now, what that means is it is population based. If you, it's a head count, and the money will then go in terms of how many people are there in one of the reasons in the province. So if there's no infrastructure, what we know is there's outward migration. So next year, there will be even less money. So it's a cyclical issue. And if we don't address it head on with proper innovative solutions, it's just going to continue.
I mean, it's really fascinating how, we think about roads as just things to move on, but you've made the case for how it's affected human rights in terms of delayed responses when it comes to either the police or emergency services, access to education, healthcare, all of those things. And then also talking about the labor issue or forcing people to leave places where they grew up, places where they're perhaps hoping to set up a life. It is really quite fascinating how roads are right at the center of all of those different things. So you talked about 33 recommendations. You've shared in part your ideas around this model of an equitable share. What are you asking for in the immediate that will start to see the situation turn around and that coverage number creep up from 10% and perhaps even potentially reach the national average of 25%?
I think that is what we want just as a starting point, just to raise the national average, which is currently at 9%, or the provincial average, to the national average of 25%. That would be looking at it through an equity lens. But we also need a wholesale approach and an immediate injection of capital. That is why the Commission has said we need alternative revenue sources. The Eastern Cape is one of the only provinces who don't have toll roads. So we don't have alternative generating mechanisms that can assist us with the maintenance and the upgrades. Similarly, we have more than 1,000 bridges that during climate change incidences simply collapse. So it's really a cyclical issue. And that is why we say a proper capital injection with proper oversight, of course, through a once-off fuel levy, perhaps, and those recommendations to be put on the table, because we cannot close our eyes to the legacy of apartheid and the legacy of infrastructure and development neglect in the rural provinces. And that's why we are saying new solutions to old problems.
All right. So you're asking the Treasury then to urgently investigate what you're talking about now. This is a once-off fuel tax. Where is that conversation? And maybe you can also just share with us who was presented with these recommendations. In other words, who bears the mantle now to enact the recommendations that you're making?
So Section 18 of our mandating legislation says the respondents, now that they've been made aware, they've got 60 days to respond to the Human Rights Commission on how they plan to implement these recommendations. Now, I've indicated there's 10 respondents specifically that we made recommendations against. Number one is National Treasury, and we've already had a response back from National Treasury on our report. Number two is the National Department of Transport. We need to upgrade our rail. Transnet needs to come to the table, and these are immediate implications to them as well. And then, of course, our provincial colleagues here in the Eastern Cape. The Department of Transport has a few immediate tasks at hand. One of them is to identify and prioritize maintenance to EMS vehicles, maintenance to SAPS vehicles. These issues, because they simply cannot, we don't have 4x4s for every department in the province. That's why these vehicles are stationed currently, a lot of them at the repair facilities. These are prioritization issues. It's not thinking outside of the box. It's in any event part and parcel of the duties of these departments. We're just saying prioritize. We're also saying prioritize tourism. Some of the tourism facilities have decreased the demands by 30% because the tourists simply can't reach the destinations. And the Eastern Cape is reliant on those sources of revenue and those sources of income. So tourism, agriculture, we really need to start prioritizing the routes to essential services as well. And those are immediate steps that the departments can take because it's part and parcel of their mandates in any event. And then there are several other recommendations that we say are innovative and that needs to be considered with a proper plan in place.
Yeah, and some of these are really just about doing the very, very basics and thinking really simplistically about what resources are already available and how they can be used more effectively. Dr. Eileen Carter, thank you very much for this morning education around the importance of roads and how it connects to so much of South African life. And let's see, and we'll continue to monitor whether these recommendations you've made are going to be animated and whether they do bear fruit for residents that you spoke to and residents in the affected areas in the Eastern Cape. We appreciate your time this morning. Dr. Eileen Carter is with the South African Human Rights Commission in the Eastern Cape.